Have you ever wondered what happens when you're put under general anesthesia during surgery? It's as if you're in a deep, dreamless sleep, oblivious to the world around you. That's the power of general anesthetics, a group of drugs that induce a reversible loss of consciousness to allow medical procedures to take place without causing you distress or discomfort. The story of general anesthetics dates back to the mid-19th century, when ether was first used during a surgical procedure. This marked the dawn of a new era in medicine, transforming surgery from a barbaric ordeal into a more humane practice. Today, anesthetics have evolved dramatically, becoming more sophisticated and safer to use. They play an essential role in surgeries, enabling doctors to perform complex procedures that would otherwise be impossible. Now that we've set the stage, let's delve deeper into the world of general anesthetics. So, what exactly happens when these substances enter your body? When general anesthetics are introduced into your system, they have one primary objective: to temporarily alter your brain's activity. These potent agents target the central nervous system, effectively inducing a state of controlled unconsciousness. But how do they achieve this? Let's dive a bit deeper. The human brain is a complex network of billions of neurons, communicating through electrical signals. These signals are transmitted between neurons at junctions known as synapses. Here, neurotransmitters, which are chemical messengers, bridge the gap between neurons, allowing the electrical signal to continue its journey. General anesthetics interfere with this communication system. They affect the receptors that respond to neurotransmitters, altering their activity. Some anesthetics inhibit the action of excitatory neurotransmitters, which are responsible for sending signals that stimulate the brain. Others enhance the action of inhibitory neurotransmitters, which decrease brain activity. The result? A significant reduction in overall brain activity, leading to unconsciousness. Now you might be wondering, does this affect all parts of the brain equally? Well, not quite. Anesthetics have a more profound effect on certain areas, such as the reticular activating system, a critical component in controlling consciousness and alertness. By suppressing this system, anesthetics ensure a deep, dreamless sleep, akin to a state of coma. These substances also work on the spinal cord, blocking pain signals from reaching the brain. Hence, they not only induce unconsciousness but also ensure that you don't feel any pain during surgery. However, it's important to note that while we have a decent understanding of how anesthetics work, there's still much we don't know. The exact mechanisms remain somewhat of a mystery, owing to the brain's complexity and our limited knowledge of consciousness itself. That's a simplified explanation of how these substances work their magic. But how are they administered? Anesthetics aren't just given out willy-nilly. There's a method to the madness. Now let's delve into the realm of how general anesthetics are administered. It's not as simple as popping a pill or getting a quick jab. It's a carefully monitored process that involves a variety of methods, each suited to different situations and patient needs. The first and most common route is inhalation. Here, the anesthetic is vaporized and mixed with oxygen or air, which the patient breathes in through a mask or a tube. This method is commonly used because it allows for precise control over the amount of anesthetic delivered, and its effects can be rapidly reversed by simply breathing in pure oxygen. Imagine it as a delicate dance between the anesthetist and the patient's body, carefully adjusting the rhythm and pace to maintain the perfect balance. However, there are situations where inhalation isn't the best choice. This is where intravenous anesthetics come into play. Administered via a needle directly into a vein, these drugs are incredibly fast-acting. They're typically used to induce unconsciousness quickly, after which the anesthetist might switch to inhalation to maintain it. Intravenous anesthetics are like the sprinters of the anesthesia world, quick off the mark and straight to the point, but it doesn't stop there. Anesthetists also have a trick up their sleeves called balanced anesthesia. This technique involves using a combination of drugs, each with different properties, to achieve the optimal anesthesia effect. It's like crafting the perfect cocktail, blending different flavors to get the desired result. And lastly, we have regional anesthesia, which numbs a larger area of the body while the patient remains conscious. This method is often used in surgeries where general anesthesia may be too risky or unnecessary. It's like the sniper of anesthetics, targeting a specific region and leaving the rest untouched. With the administration covered, let's move on to the types of general anesthetics. Not all general anesthetics are created equal. There are several types, each with their own characteristics. Let's start with the most commonly used type, the inhalation anesthetics. These gases or vapors are breathed in through a mask or a tube. Examples include isoflurane, sevoflurane, and desflurane. They're often used for longer procedures because they allow for precise control over the level of unconsciousness. However, they can cause nausea and confusion when waking up. Next up are intravenous anesthetics, which are injected directly into a vein. Propofol, etomidate, and barbiturates like thiopental fall under this category. These agents work quickly and are often used for shorter procedures or to induce unconsciousness before switching to inhalation anesthetics. They can sometimes cause a burning sensation at the injection site or lower blood pressure. Then we have the opioid analgesics. Yes, they are technically not general anesthetics, but they're often used alongside them to provide pain relief. Morphine, fentanyl, and remifentanil are examples. They're powerful painkillers, but they can also cause drowsiness, slow breathing, and in some cases, addiction. Lastly, we have adjunct anesthetics, which are used in combination with other anesthetics to enhance their effects or to counteract side effects. For instance, benzodiazepines like midazolam can reduce anxiety and memory of the procedure, but may also cause dizziness and unsteadiness. As you can see, the choice of anesthetic depends on various factors such as the procedure's length and complexity, patient's health, and potential side effects. It's a delicate balance that anesthesiologists have to strike to ensure unconsciousness, pain relief, and minimal side effects. So, whether it's a simple tooth extraction or a complex heart surgery, there's an anesthetic out there designed to make the procedure as comfortable and safe as possible. Now that we've covered the types, let's talk about the safety aspects. While general anesthetics are a boon to modern medicine, they aren't without their risks. Diving into the safety aspects of general anesthetics, it's essential to recognize that these substances are meticulously tested and regulated. In most cases, they are safe when administered by qualified professionals. Anesthesiologists undergo rigorous training to ensure that the right dose is given, tailored to the patient's age, health status, and the type of surgery being performed. However, like any medical procedure, the use of general anesthetics comes with potential risks and complications. These risks can range from minor to serious, and they may vary depending on individual health conditions. Common side effects can include nausea, vomiting, dry mouth, and a sore throat. While these are typically temporary, they can be distressing. More severe complications, although rare, can occur. These include allergic reactions, breathing problems, heart attack, or even stroke. This is why a detailed medical history is taken before the procedure to identify any potential risk factors. Certain groups are at a higher risk of complications from general anesthesia. These include the elderly, those with chronic illnesses such as heart disease or lung disease, and those who smoke or consume alcohol regularly. But fear not, medical professionals take numerous precautions to minimize these risks. Monitoring during the procedure is rigorous. Vital signs such as heart rate, blood pressure, and oxygen levels are constantly checked. In case of any abnormality, the anesthesiologist can quickly adjust the anesthesia level or take other necessary actions. Post-procedure, patients are not left alone until they regain consciousness and their vital signs are stable. This period of observation allows for any immediate complications to be identified and addressed swiftly. Moreover, research and development in the field of anesthetics are ongoing, consistently improving safety and effectiveness. Newer drugs with fewer side effects and advanced monitoring techniques are continually being introduced. While there are risks, the benefits of general anesthetics far outweigh them. After all, they allow for pain-free surgeries, contribute to faster recovery, and enable life-saving procedures that otherwise would be intolerable or impossible. So while it's important to be aware of the risks, remember that anesthesia is a critical tool in modern medicine. Let's recap what we've learned today about general anesthetics. These powerful substances are the unsung heroes of modern medicine, ensuring patients drift into a painless, unconscious state during surgeries. They function by interacting with our nervous system, specifically by inhibiting certain neural pathways to create a state of controlled unconsciousness. We've also explored the various methods of administration, including inhalation and intravenous methods, each with their own advantages and uses. We've delved into the different types of general anesthetics such as propofol and sevoflurane, and how they cater to diverse surgical needs. Lastly, we discuss the safety and risks associated with these substances. While they are generally safe under professional care, potential risks can occur, including allergic reactions and post-operative confusion. It's a complex field, but a fascinating one, offering a deeper understanding of how we navigate the intricate world of surgery and pain management. And that's a wrap on general anesthetics. Subscribe for more because you won't find me later.